Welcome to another Real Talk today with Dr. Lon. We are covering insulin resistance. This term gets thrown around a lot, so that's why we wanted to go over it, and I think there's a lot of confusion around it. So the definition of insulin resistance is your body not responding appropriately to the hormone that is insulin. It's really a blood sugar control hormone. Now, people get confused with, well, if I have insulin resistance, does that mean I have diabetes? No, not necessarily. Insulin resistance is just the first step towards the development of diabetes and metabolic syndrome. So they are all separate entities. So if you are not measuring it early as insulin resistance, it may be asymptomatic, which means you may not be getting diagnosed until you've already developed pre-diabetes, an actual clinical condition. How is insulin resistance measured? In a clinical setting, traditional medicine just uses the A1C. Functional medicine, you're gonna either see a fasting glucose plus an insulin level, or occasionally you'll see an oral glucose tolerance test measuring the glucose change over time. All right, so what are some of the causes of insulin resistance? Well, there are some people who are just genetically predisposed to it. Being obese or overweight, major driver of insulin resistance there. Diet plays a huge factor in that. Exercise or lack thereof plays a huge factor in that as well. So each of those by themselves are driving factors of insulin resistance. And then stress would be kind of the last big one that we see, particularly in our clinical practice. So the main symptoms that you might experience if you're suffering from insulin resistance or developing it would be fatigue primarily, weight gain would be another big one, or struggle with weight loss, and then some blood sugar fluctuations. And finally, what can we do about insulin resistance? How can we reverse it? Well, really comes back to what's the root cause, right? So if it's weight, then losing weight. If it's your diet, then it's changing your diet. Getting rid of processed foods would be the first big step. If you're really inactive, being more active is gonna make a really big difference in reversing your insulin resistance. If stress is a big factor for you, managing your stress, figuring out where is it coming from, what can I do about my stress, that's gonna get you there. What else should I say about that? There you go.